Hi everyone, Dr. Rich Castellano, the Smile Doctor here at Image Lift. Thank you, Donna, for letting me share your video today. So it was back in 2020 that we did the lift, right? So time flies. We were looking at your pictures. What did you think when you saw the neck and the jawline here?
Complete difference.
Yeah. Looks really good. Holding up very well. You wear it well. And today we're going to do a little bit of the lip filler and some of the wrinkle relaxer up here. So for those of you watching, this is what we're looking for, is that the fullness in the jawline, the neck, her profile, big improvement, looks natural, not overdone. And so what was it that inspired you, Donna, to have a cosmetic treatment? I'm curious.
I just was, I like to watch TV, botched, and I was like, I don't want to be botched. I want a good doctor, and I started doing some research, and I found you, so okay. Here I am.
Well, we're glad that you did. So I'm going to get started now with the lip filler. We're going to do some of the Restylane, and we're doing 2 areas of the wrinkle relaxer.
Yes, sir.
So for my physicians and students that are watching, I like to use about 16 units per area, and the reason why is because that's a good dose that will give you a result, but it doesn't totally wipe out expression.
Yeah.
I do have some patients that they say, I want to wipe out the expression. I try and talk them off the ledge. Let me have you rest your head all the way back for me. And a little cleanse on the skin here. Because, you want to look natural, but if someone wants more wrinkle relaxer, we can always add more. So it's customized.
Right.
But this is a dose that we found that patients have been very happy with.
Mm-hmm.
And also, we're going to be doing that lip plumper. So you wanted, now just to verify, we talked about this, but let me show you one more time. Hold this for me, please, Donna. I'm going to raise you up a little bit here. Raise your feet up. So we're going to do a little plumping around the lips and then a little bit in the corner of the mouth. Is that what you were thinking?
Whatever you think, because you do the perfect job.
Yep, and then across, can you purse the lips like you're going to whistle? And then we'll help with those little creases across. And you got your lip liner on. You do such a good job with that.
I should have took it off, but
that's
it's the
okay.
first thing I put on.
No worries, that's okay. I'm going to do a little more cleanse here. Our A+ students looking for extra credit. Donna is very active, many active years ahead. Did you tell your friends what you were doing today, Donna?
No.
They won't figure it out. You will pass the grocery store test today.
Yeah.
So I'm going to do a little bit of the numbing medicine. I'm going to turn your head to the middle. I'm going to lift your lip like this, and then just relax as best you can. You feel buzz. Pinch on 3. 1, 2, 3. Pinch. So do you feel small, medium, big pinch? Not too bad?
Mm-mm.
You're doing great. If you need a break, you let me know. I'm not in a hurry. Everything's looking great. So I like to use, for my physicians and students that are watching, I like to use the modified dental block because the oral mucosa here, it's easier to numb, it's more comfortable, and we're not in a hurry. You just take your time, numb across the lip, and a little pinch there. And before you know it, the lips feel very numb. Little pinching. Now right there, do you feel small, medium, big pinch? Medium?
Mm-hmm.
It will go slowly. How about here, a little pinch? Not too bad?
Mm-mm.
Very good. We're very excited. We have our new South Tampa office, which is beautiful. Love to have you out there. I know it's a little bit of a drive for you, Donna. We're out in our Villages office today.
Mm-hmm.
But if you've not seen our South Tampa office, you are going to be amazed. So I'm going to turn your head just a little bit this way. And you'll feel buzz and then pinch. 1, 2, 3, pinch. Sorry, a little pinch there. So with lip filler, everybody says the same thing. They say they don't want too much, which we won't do that. We do enough that you get a result, but your family and friends cannot figure it out. That's the key. Some patients, we love to get a compliment, but when they can't figure it out, you see the difference in the before and afters, and people think, well, you look natural.
Mm-hmm.
That's the goal. We've all seen it when it's too much. We're not going to do that. Everybody says they don't want the duck lips. They don't want the bee-stung lips.
Mm-mm.
So we won't do that. Now, when we do the numbing medicine like this, you will feel overdone, and that goes away about 30 minutes, 45 minutes. But that's temporary. The lip filler stays and you look natural.
Mm-hmm.
Little pinch there. Everything's looking great. So now I'm gonna blot, and there's no drooling, I promise, okay? Here we go. Okay, I'm gonna lift up and through here. You feel a little bit of a pinch, not too bad?
No.
And a little pinch in the corner, 1, 2, 3, pinch, sorry, a little pinch. Very good. So I'm using about 3 cc's of 1% Lido with Epi. 1, 2, 3, pinch. Very good. My team has everything set up perfectly for it. We have over 35 staff here dedicated to your care.
Mm-hmm.
Perfect. You feel a little pinch there or not really?
Yep.
A little bit of numbing through here. Very good. I like to do a little extra numbing just for good measure. Okay, there's no drooling, I promise. It feels numb and goofy, but it looks really good. Now, what I like to do is I start out in the corners of the mouth, because that's an important area to address. We get that downturn, and so I just bolus that area. Bolus is a fancy word for just putting a larger amount of product, and I'm going to massage that immediately. So once I do the corner of the mouth, then you can also put a little Botox in the corner of the mouth if that is, you know, we have a muscle that pulls us down like this.
Mm-hmm.
You can come a little closer, Janice, if you get a better view. Thanks. And I'll massage it straight away. And then I'll go to a little bit of the lip volume. That looks very natural. Patients will tell me if they say, well, one side of my lip is a little higher, one's a little lower. You're always going to have one side that's a little different.
I've never noticed.
And we smile a little harder on one side than the other. So there's a lot of variables there. You feel a pinch there, not too bad?
Mm-mm.
Everything's looking great. So first I do the vermilion border. And thank goodness for lidocaine, because you're not really feeling what I'm doing.
Mm-mm.
Very good. So if you're just now joining us, this is lip filler done the right way. It's got to look natural. You'll pass the grocery store test the same day. We treat the little fine creases in the lips. And as we get older, it's very normal that we will lose volume in our lip. So we're just putting back what was once there. We keep it that simple. Perfect. Are you feeling any pain there?
Nope.
It breaks my heart when patients tell me they went and had lip filler and they said, oh my goodness, it was so painful. You can see right here, lip fillers do not have to be painful.
Dr. Rich, we have a question.
Yes, go ahead.
How long does that last?
So when you do the lip plumper with the hyaluronic acid, it lasts about a year. We do have permanent fillers that we use all throughout the face, but the hyaluronic acid, it gets a better result, and the permanent fillers really aren't indicated for use in the lips. So it lasts about a year. That's the best option for lip plumping. You can do some wrinkle relaxer for the corners of the mouth and the lip flip, and that's gonna, you have to repeat that 2 or 4 times a year for the Botox Dysport Xeomin Jeuveau. That's a very good question. Thank you for asking. And thank you for watching. Please share if you've got a family member or friend that they're thinking about doing treatments. Share this video because you want them to go to someone who knows how to do it. Most injectors, you're so sweet. Most injectors out there, there's a lot of them. Most of them are beginners or intermediate level. So a lot of times you don't even know that they're not that experienced. You don't want people practicing.
And a lot of dentists are starting to do it.
You don't want people practicing on your face. So get it done the right way the first time around. We are honored to be your facelift and filler center of excellence. That's all we focus on. Face, fillers, laser, skincare. Our master injectors are amazing. Perfect. And I feel like I'm at the Ritz-Carlton every day. My team is taking such amazing, great care of me. They're going to take great care of you as well. Okay, just a little bit left to go. I like what I see. I just put just a little touch here. Very good. Just balancing the top and the bottom. So I'm staying superficial here. That way we're staying away from the blood vessel. You know, and of course, you looked amazing before. Donna looks amazing before we did anything. So just little finishing, polishing touches here. And we're going to do some of that wrinkle relaxer. You doing okay?
Yes, sir.
Very good.
That's why I drive 2 hours.
We get a lot of patients from out of town.
Mm-hmm.
So now we're using the, what was it that you called this area in here in the middle? The B lines. She's so nice. Donna is not a B-type person. You feel buzz and then pinch 1, 2, 3, pinch. But let's be honest, we all have our limits, right? You know, 1, 2, 3, pinch. Pinch. You feel small, medium, big pinch, not too bad. Pinch. I like to use the buzzer because the brain, little pinch, can only focus on so many things at one time. So the buzzer makes it a little bit easier. So we keep it this simple. Donna's back into the world again. So proud of her results from the lift and then getting her little lip filler. Raise your eyebrows up real high for me. So we see the creases here now. Relax as best you can. So I'll do a little pinch. 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 I'm just doing 1 unit per area here. And maybe half a unit here laterally. And then another unit and a half in the lateral tail of the brow. Pinch. Pinch. 1 and a half in the tail of the brow. And a little half unit here. Pinch. Pinch. You doing okay, Donna?
Mm-hmm.
She's tough. Pinch. We try and make it easier than the dentist's office. Pinch. Raise your eyebrows up real high for me, and then just a little bit more here. A little pinch. And pinch. So that wasn't too bad, was it?
Yes, sir.
Very good. You are ready for the grocery store. That's for sure. You will pass the grocery store test. Let's take a look in the mirror. Hold this for me. There you go. So, a little swollen. How's it look so far?
Good.
Corners of the mouth, the lips. We give it 2 weeks. If at 2 weeks you think you need a little more wrinkle relaxer, come back. But we don't want to do it before then because if it's still setting in, you don't want to add more if you're not going to need it.
Then
So
you're going to have the fake look.
that's right. So one more, I'll hold this for you. One more time, just to show off 2020, we did the lift, and I love the profile in the neck and the jawline. You look great from every angle, and then you see her lips and just a little bit of plump. There's a little bit of numbing medicine, and you will pass the grocery store test today. I'm gonna give you a hug. You did great.
I got to go to Palm Coast. Time I get over there, the light cam will be out.
There you go. Congratulations. And thank you all for watching. We're on a mission to stop bad
Come
plastic
and see
surgery.
the real professional.
We're here to do, thank you. We're here to do things the right way. We'll see you in the next video. Please share and thank you for watching.